Jen. I'm an actual physician, and I'm here to do some intense tapping while we talk about the evidence behind ASMR and a little bit of depression medicine. Now, these are vinyl gloves. Can you hear them in your ear over here? And over here. Over here, over here, over here, over here. And here. So, you guys request these a lot. So, what is ASMR? There is a lot of debate, I think, within the ASMR community as to what is this thing, this sensation thing. And there are people, there's, discussion, but the medical definition is, the autonomic sensory meridian response. The medical definition is that you are likely triggering a change in your sympathetic nervous system and upregulating your parasympathetic nervous system, okay? Causing an increase in skin conductance on your scalp along the flow of those areas of your brain. Not your brain, your skin. This is distracting me. These are gloves. Now, what does that mean, an increase in skin conductance? Well, so they did a study. I can pull it up for you right here. I can pull it up for you right here. I can pull it up for you on this side as well. Over here on this side. So, a Dr. Blakely, Hostler, and Veltri did an experiment which was published. It was published in published in a peer-reviewed scientific journal. I have the PubMed ID here. The study is called More Than a Feeling, Autonomic Sensory Meridian Response. How about if I stroke your head? How's that? Autonomic sensory meridian response is characterized by reliable changes in affect and physiology. Now, I've said a lot of long words so far. What is affect? Affect is the measurable emotional response, the stuff we can observe, not what you say you feel. For example, you might say you feel sad and you might be smiling. You might actually feel sad, but the affect is the smile. It's the thing that somebody can observe about you. Now, I also mentioned skin conductance. So in this study, they had people who experience ASMR watch ASMR. But Jen, you might say, is the tingles the only thing that is the ASMR? Because that's what you mean by skin conductance, right? Skin conductance means that the little cells in your skin, the nervous cells, right, from your nerve endings, that they open up and let sodium and potassium and chlorine move, in and out of the cells, right? That's basic electrophysiology. And then a little action potential, which is like an electric charge, goes up the cell and, all the way along the other cells. It triggers a chain reaction, and that charge goes all the way up to your brain, right? That is how your nervous system works, and that's based on, that was first reliably understood with studies on squid, actually. Squid cells. So, an increase in skin conductance would be, something is going on. We can measure that the nerve is responding to a stimuli, right? And that's what I mean by an increase in skin conductance. ASMR is the tingles. That doesn't mean if you don't experience the tingles else that you can't enjoy ASMR. These are two different kinds of little tiny forceps. You see, these ones with the teeth are really useful for grabbing tissue when you want to hold on to it while you're suturing. These ones without the teeth might be better if you want to get something out of somebody's ear. It depends on the position and what they want. And of course, this used to be used. Some people still carry it, and it's still very good. It's not like it's outdated, it's just that there's, other options right now. You'd have to have a lot of this to stop clotting. So I actually bought this for veterinary purposes. I'm not a vet, but I do a lot of home care on my animals, and I was worried that a bird would bite another bird, and so we got this so she wouldn't bleed if something happens. And birds have very little blood in their bodies, and they the slow build, and then the final like boom. That's the sympathetic system. So ASMR is localized to a different part of the body, a different part of the brain, and it's very specific, right? It's very, very, very specific. The problem is that in a lot of societies, especially internet society, we equate everything is sex. So you can't have anything pleasant that isn't somehow sexual. under 12 minutes a mile with like 45 to 50 pounds on my back for 10 miles at a time, which is pretty fast. I was doing jiu-jitsu every night. I was killing it. I was biking at least 10 miles a day, you know. And I was pretty hardcore. Then my mental health was suffering a lot. But my fibromyalgia has been kicking my butt, and so that affects my ability to practice, because I'm not going to practice unsafe. I'm not going to practice when I can't concentrate because of the pain. And then someone else gets hurt, right? I'm not. That's very selfish, I think. So, because I'm not going to let that happen. I'm not going to let my own drive hurt somebody else. But I can still practice on a limited basis, and I am finding these awesome, curated, neat help items that I've searched for as part of the relaxation club. I'm always trying to find cool things. I want to become the premier relaxation doc in the world as I study relaxation and stress and how to optimize your well-being to make a difference in the world so that you can make a difference and I can make a difference. And that's kind of the philosophy behind Tingles too, which is also healthy. And green tea is supposed to, there's studies about improving cognition. That's in other videos. I won't link those studies here. You can look that up. Ginger and peppermint are both literally tingly items. So I think it'd be kind of neat to try, you know, getting that kind of like oral or, you know, internal tingle going while you listen to ASMR and kind of amp up the experience, you know, get those tingles, get them. Also, they're both, ginger and peppermint are both been proven to be useful for nausea, and that's, you can go on PubMed and fact check me there. That's pretty easy. So, yeah, that's the, oh, and all of the tins and pouches, listen to this, all of them, I kind of went to finding the ASMR effect. Isn't that rad? Rad, right? So, yeah, I know you guys like this from the time traveling ASMR vid. So why am I telling you all these things? Why am I telling you about T's and DBT and CBT in your ASMR journey? Well, because all of these things can be used in your scientific arsenal to helping you get better. And why do I want to help you? You have a pretty face. You have something on your pretty face. Why do I want to help you get better? Oh, it got dark. Hi there. Can you see me? There we go. Why do I want to help you get better? Well, because I think we're all connected, and this is why I don't want you to die. I get sad when I see you guys wanting to harm yourselves. I think you should still talk about it so that we know and we can get you better. But, you know, and that's why I always include links to the crisis text line below. But you are a part of me. We're all connected. We are all part of the same, you know, the same human family. Whether you believe in Adam and Eve and we're all children of that, or whether you believe that we all come from a common primate ancestor, there's no getting around it. No matter what you believe, we are all family. You have to believe some really, really random weird stuff in order to not believe that. Hitler in Mein Kampf believed in like alien angel stuff. So I haven't read it, so I can't entirely confirm. I have been told secondhand that he believed in weird alien angel stuff to back up the idea that Aryans were superior because they were descended from this alien angel race, right? I haven't read it. I need to read stuff before I make claims about it, right? Even bad guys, we have to check and make sure that we're telling the truth about their historical claims, because otherwise we can be misled. If you don't know history, you don't necessarily know how to control your future. I'm also a history major, so that's the thing. And of course, those of you who saw the Viking medical video, you know that. There are a couple history videos I